In Kentucky's coal country, where abandoned mines scar the mountains and federal records hide the truth, some mysteries run deeper than statistics can measure. On a humid Tuesday morning in September 2021, federal statistical analyst Jennifer Walsh pulled her rental sedan into the gravel parking lot of the Benham Township Community Center in Harlan County, Kentucky. The building, a converted coal company commissary from the 1920s, would serve as her temporary field office for what should have been a routine census follow-up survey. Walsh, 34 and a 12-year veteran of the Census Bureau's Demographic Analysis Division, had been dispatched to southeastern Kentucky to conduct delayed health and mortality surveys stemming from the 2020 census. The COVID-19 pandemic had disrupted data collection across rural America, leaving gaps in federal databases that needed filling. Benham Township, with its official population of 847, was one of dozens of communities on her assignment roster. But as Walsh reviewed her preliminary data that September morning, the numbers told a deeply troubling story. According to her initial door-to-door surveys conducted over the previous week, mortality rates in Benham appeared to be running nearly 40% higher than state health records indicated. In a community where official death rates should average 12 to 15 people annually, local funeral director Marcus Clay had processed 31 burials in 2020 alone. The discrepancy extended far beyond mortality statistics. Walsh's clipboard surveys revealed families living in structures that federal databases listed as condemned or uninhabitable. Entire streets of coal company housing, officially vacant according to HUD records, showed clear signs of occupancy. Fresh laundry hanging on lines, children's toys scattered in yards, wood smoke rising from chimneys on cool mornings. Even more perplexing was the community's systematic reluctance to participate in her health surveys. Despite federal law requiring census cooperation, nearly 60% of residents refused to answer questions about household composition, income, or medical conditions. When Walsh pressed for explanations, she encountered the same response repeatedly: deep mistrust of government health studies. "They've been asking us questions about our breathing and our cancers for 50 years, 73-year-old retired miner Earl Whitman told her during one of the few interviews she managed to complete. "Never seen one bit of help come from all that asking." Whitman's comment pointed to something Walsh had not anticipated when she accepted the Harlan County assignment. The region's history with federal health research stretched back decades, marked by studies that documented widespread occupational disease, but produced little meaningful intervention. Coal miners had participated in black lung research, environmental health assessments, and community wellness surveys, only to watch their neighbors continue dying of respiratory disease, while official statistics somehow failed to capture the full scope of the crisis. As Walsh compiled her initial findings that Tuesday morning, a disturbing pattern emerged. Streets like Lower Lynch Road and Pine Mountain Avenue appeared in her census database as having 12 to 15 occupied households, but her physical surveys revealed only 4 or 5 families actually living on each street. Conversely, areas like the old company housing behind the abandoned Benham coal and coke plant appeared uninhabited in federal records, yet clearly housed multiple families in structures without running water or reliable electricity. The mathematical impossibility of the situation bothered Walsh on a professional level. Federal demographic models depended on accurate population counts for everything from emergency response planning to healthcare resource allocation. If Benham's numbers were this dramatically skewed, what did that mean for similar communities across Appalachia? By late afternoon, Walsh had identified what appeared to be systematic gaps between official records and ground truth. The question that would drive her investigation deeper into Harlan County's hidden demographics was becoming unavoidably clear. Why did the federal government's own data so dramatically misrepresent the health and housing reality of this former coal town? 3 days after her initial data review, Jennifer Walsh found herself sitting across from Earl Whitman in the dim light of his kitchen on Clover Fork Road. The retired miner had initially refused her survey request, but curiosity about her persistent questions had eventually overcome his skepticism. What he revealed during their 2-hour conversation would fundamentally reshape Walsh's understanding of Harlan County's hidden health crisis. Whitman had worked underground for 37 years, starting at age 16 in the International Harvester Company's Lynch mine, and finishing his career in the smaller operations that tried to extract remaining coal from played-out seams. Like most men of his generation, he'd developed chronic obstructive pulmonary disease, what local people still called black lung. But according to Whitman, his condition had never been officially diagnosed as such. Company doctor always wrote down chronic bronchitis, Whitman explained, his words punctuated by a persistent cough that seemed to come from deep in his chest. Said it was better for the insurance claims. But you look around this holler, and every man my age sounds just like me when he tries to climb them steps. Whitman's observation aligned perfectly with disturbing patterns Walsh had noticed in her preliminary health surveys. Community members reported widespread respiratory problems, unusual cancer clusters, and premature deaths that somehow had not found their way into state health statistics. The mathematical discrepancy suggested systematic underreporting of occupational and environmental illness on a scale she'd never encountered. The mining legacy in Benham extended far beyond the closed shafts. Whitman led Walsh to his back porch, where they could see across the narrow valley to the abandoned tipple and processing facility that had once employed 800 men. Even decades after closure, the industrial infrastructure continued to impact community health through groundwater contamination and methane seepage from improperly sealed mine openings. "You smell that?" Whitman asked, gesturing toward the valley floor where a brownish creek wound between clusters of trailers and small houses. "That is sulfur coming up through the ground. Been getting stronger the last few years. Makes some folks sick to their stomachs, but ain't nobody testing that water regular like." Rosa Martinez, a community health worker with the county's understaffed health department, confirmed Whitman's observations when Walsh interviewed her later that week. Martinez had been documenting health patterns in Benham for 15 years, maintaining detailed records that painted a picture of environmental illness far more severe than official statistics indicated. "The respiratory problems are just the beginning," Martinez explained from her cluttered office above the Cumberland post office. "We are seeing stomach cancers, skin conditions, birth defects, but people here do not go to doctors unless they are dying, and when they do, the conditions get coded as something generic. Chronic bronchitis instead of black lung, stomach problems instead of chemical exposure." Martinez's unofficial health surveys, conducted door-to-door in much the same manner as Walsh's census work, revealed illness rates that seemed mathematically impossible when compared to state health department data for Harlan County. In Benham alone, she documented 47 cases of severe respiratory disease among men over 50, 32 cases of various cancers in adults under 65, and 8 cases of developmental delays in children born since 2015. None of these numbers appeared in Kentucky's official health surveillance databases. The reasons for this data gap became clearer as Walsh learned more about healthcare access in the region. Many families lacked insurance or transportation to reach specialists who might properly diagnose occupational diseases. Local clinics, overwhelmed and underfunded, often treated symptoms rather than investigating underlying environmental causes. Meanwhile, workers' compensation claims for coal-related illness faced lengthy legal battles that many families could not afford to pursue. Perhaps most significantly, both Whitman and Martinez described a culture of medical mistrust rooted in decades of company doctors who had systematically underreported occupational hazards to protect mining operations from liability. The legacy of that medical gaslighting continued to influence how community members interacted with health officials, including federal analysts like Walsh. "People learned not to expect help from outside," Martinez explained. "They learned that telling the truth about their sickness could cost them their jobs, their benefits, their housing, so they stopped telling the truth, even when it might actually help them." As Walsh reviewed her notes from these interviews, a troubling picture emerged. Benham appeared to be suffering from an ongoing public health crisis that was effectively invisible to federal monitoring systems. The community's isolation, combined with systematic undercounting of environmental illness, had created what she began to think of as a demographic shadow, a place where hundreds of people lived with serious health conditions that simply didn't exist in government databases. The question driving Walsh deeper into her investigation was becoming increasingly urgent. If official health statistics so dramatically underrepresented the reality in Benham, how many other former coal communities were suffering similar invisible crises? And what federal policies might be based on similarly flawed demographic assumptions? The answers, she was beginning to suspect, would challenge everything she thought she knew about rural health surveillance in America. On the evening of September 28, 2021, Jennifer Walsh loaded her survey materials into her rental car for what she intended to be her final night of data collection in Benham Township. She had spent 3 weeks documenting discrepancies between official records and community reality. But one area of town remained largely unsurveyed: the abandoned mining company housing district that locals called Lynch Hollow. Lynch Hollow presented unique challenges for census work. The neighborhood consisted of nearly 40 coal company houses built in the 1920s, most of which appeared on federal databases as condemned and uninhabitable. HUD records indicated the structures had been slated for demolition since 2018, with utility services officially disconnected. But Walsh's informal observations during previous site visits suggested a very different reality. Driving through the hollow that evening, Walsh noted unmistakable signs of occupancy in structures that supposedly had no residents. Generator exhaust rose from behind houses listed as empty. Solar panels and satellite dishes appeared on roofs of buildings marked for demolition. Children's bicycles sat in yards of homes that federal records indicated had been vacant for 3 years. Walsh's first survey stop was 1247 Lynch Hollow Road, a 2-story company house with peeling white paint and a sagging front porch. According to her database, the structure had been condemned in 2019 due to foundation subsidence caused by underground mine collapse. But when she knocked on the front door at 8:15 p.m., a woman answered with 2 young children visible in the background. The woman, who identified herself only as Sarah, initially refused to participate in the survey. But after Walsh explained that she was trying to ensure accurate population counts for federal aid programs, Sarah reluctantly provided basic household information. She lived in the house with her husband, 2 children, and her elderly mother-in-law, Dottie. They had no running water due to broken pipes, but they had electricity through an extension cord run from a neighbor's house. Her husband worked sporadically in logging operations, and they received food assistance through county programs. None of this household's 5 members appeared in any federal database Walsh could access. As Walsh continued her surveys through Lynch Hollow, a disturbing pattern emerged with mathematical precision. Nearly every house she visited contained families who were essentially invisible to federal monitoring systems. They received no mail delivery, appeared on no utility records, and had no official addresses for tax or voting purposes. Yet they existed, raised children, sought medical care when they could afford it, and died without their deaths being reflected in official statistics. By 10:30 p.m., Walsh had completed surveys at 12 households representing 37 people who didn't officially exist according to federal databases. The demographic implications were staggering. If similar undercounting occurred throughout rural Appalachia, federal resource allocation based on official population figures could be systematically shortchanging the communities most in need of assistance. But the most troubling discovery came when Walsh analyzed health data from her Lynch Hollow surveys on her laptop, back at the FEMA trailer that served as her temporary residence. Respiratory illness rates among the Hollow's residents appeared to be running nearly triple the county average. Of the 18 adults she'd surveyed, 14 reported chronic breathing problems, persistent coughs, or other symptoms consistent with environmental exposure to mining-related toxins. More significantly, the geographic pattern of illness seemed to correlate directly with proximity to abandoned mine openings and contaminated groundwater sources. Families living closest to the old Lynch mine portal reported the highest rates of respiratory symptoms and gastrointestinal problems. Working late into the night, Walsh cross-referenced her health survey data with federal mortality statistics for Harlan County. The discrepancies were mathematically impossible to explain through normal statistical variation. Official death rates suggested a community with health outcomes similar to suburban Kentucky. Her ground-level data revealed a population suffering from environmental health impacts comparable to industrial disaster zones. At 11:47 p.m., Walsh placed a call to her supervisor, Senior Analyst David Reeves, at the Census Bureau's Atlanta Regional Office. According to phone records later obtained by investigators, the call lasted 18 minutes. While the content of the conversation was never officially documented, Walsh's handwritten notes from that evening, found later in her trailer, suggested she had discovered what she termed systematic data suppression at federal level. Not as she. Walsh's notes, written in her characteristic precise handwriting, included calculations showing how official health statistics for Harlan County appeared to have been mathematically adjusted downward from raw data. She had identified a pattern of underreporting that extended beyond simple clerical errors or missed cases. The numbers suggested deliberate manipulation designed to minimize the apparent impact of coal mining on community health. Most concerning were Walsh's preliminary conclusions about federal health grant allocations. Her analysis indicated that rural health programs received funding based on official illness rates that bore little resemblance to actual community needs. Areas like Lynch Hollow, suffering from severe environmental health crises, received minimal federal assistance because their problems were not reflected in official statistics. In her final note, time-stamped at 12:23 a.m. on September 29th, Walsh wrote, "Pattern suggests coordination between state health debt and federal oversight to minimize reported mining health impacts. Need to verify a data trail back to CDC and EPA databases. This could affect hundreds of communities. And sometimes so many. How?" Walsh's laptop showed internet activity until 12:31 a.m., when she appeared to have been uploading encrypted files to a secure federal server. After that, electronic records of her activities ceased entirely. At 6:00 a.m. that morning, maintenance workers found Walsh's rental car running in the parking lot outside her FEMA trailer, driver's door ajar, keys still in the ignition. Jennifer Walsh was nowhere to be found. The discovery of Jennifer Walsh's abandoned rental car at 6:17 a.m. on September 29, 2021, triggered a response that would later strike investigators as both swift and strangely muted. Maintenance worker Billy Hoskins, arriving early to repair a broken water line at the FEMA temporary housing site, found the silver Chevrolet Impala idling in the parking lot with its driver's door standing open. Hoskins later told Kentucky State Police that the engine was still warm, suggesting the car had been running for hours. Walsh's purse sat on the passenger seat, containing her identification, credit cards, and $347 in cash. Her cell phone lay on the dashboard, battery completely dead. But there was no sign of Walsh herself anywhere on the property. The interior of FEMA Trailer Unit 23B, Walsh's temporary residence during her census assignment, told a more complex story. Her laptop computer sat open on the small dining table, still connected to a mobile internet hotspot. The screen displayed what appeared to be an encrypted file transfer interface, though the actual files being uploaded were protected by federal security protocols that local investigators could not access. Sergeant Michael Torres of the Kentucky State Police, who responded to the initial missing person report, noted several unusual aspects of the scene in his official report. Walsh's bed appeared to have been slept in, but her work clothes from the previous day lay neatly folded on a chair. Coffee cups and dinner dishes had been washed and put away. The trailer showed no signs of struggle, forced entry, or hasty departure. More puzzling was what investigators found in Walsh's work materials scattered across the trailer's small workspace. Her survey clipboard contained completed forms from 12 households in Lynch Hollow, documenting 37 residents who didn't appear in any federal database. Her handwritten notes included detailed calculations about health statistics and repeated references to systematic data manipulation and coordinated underreporting patterns. Most significant was a draft report titled Demographic Invisibility in Post-Industrial Communities, Evidence of Federal Health Data Suppression in Harlan County, Kentucky. The 23-page document found on Walsh's laptop outlined her theory that official health statistics for coal mining regions were being systematically adjusted to minimize the apparent impact of environmental hazards on local populations. Sergeant Torres initially treated Walsh's disappearance as a standard missing person case, following established protocols for adults who vanish under unclear circumstances. He interviewed neighbors at the FEMA site, reviewed what little local surveillance footage existed, and began organizing search teams to cover the mountainous terrain surrounding Benham Township. But the investigation took an unexpected turn when senior analyst David Reeves arrived from Atlanta, less than 12 hours after Walsh's disappearance was reported. Reeves, whose official title was Regional Security Coordinator, came accompanied by 2 FBI agents and immediately assumed control of the case, classifying Walsh's work materials as sensitive federal documents. According to Torres's later testimony to state investigators, Reeves seemed less concerned with finding Walsh than with securing her research. The federal agents spent hours in her trailer, copying files and removing documents. When Torres asked about standard search procedures for the missing analyst, Reeves suggested that Walsh had likely left voluntarily due to stress related to her assignment. He kept calling her an outsider, Torres later recalled during interviews with reporters. Said she was not used to rural assignments and might have been overwhelmed by the community's hostility toward federal surveyors. But I had been talking to people around town, and nobody seemed particularly hostile toward her. Cautious, maybe, but not hostile. The federal response to Walsh's disappearance struck local law enforcement as oddly bureaucratic and controlling. Rather than launching an immediate comprehensive search operation, Reeves ordered Torres to treat the case as a voluntary departure unless concrete evidence of foul play emerged. Walsh's rental car was returned to the agency. Her trailer was sealed and sanitized, and her official assignment was quietly transferred to another analyst. Perhaps most troubling was the handling of Walsh's research findings. Her encrypted files remained locked, with FBI technicians claiming they contained sensitive demographic methodology that could not be shared with local investigators. Her draft report on health data manipulation was classified under federal information security protocols, effectively removing it from the missing person investigation entirely. Community members who had been interviewed by Walsh reported unusual federal activity in the days following her disappearance. Rosa Martinez, the community health worker, noticed unmarked vehicles parked near her office and suspected her phones were being monitored. Earl Whitman reported that federal agents had visited his home, asking questions about Walsh's mental state and her interactions with local residents. They were not asking if we'd seen her or where she might have gone, Whitman later explained to local reporters. They were asking if she seemed unstable, if she'd said anything about leaving town, if we thought she might have made up the numbers she was so excited about. The official investigation into Jennifer Walsh's disappearance effectively ended after 72 hours. Despite standard protocols calling for extensive searches and public appeals for information, federal authorities concluded that she had left voluntarily and classified her case as a low-priority administrative matter. But questions about Walsh's fate and her research findings continued to circulate through Benham Township. Residents who had participated in her surveys began to wonder whether their cooperation had somehow contributed to her disappearance. The health data discrepancies she had documented remained unresolved, leaving an entire community's medical reality hidden from the federal agencies supposedly tasked with protecting public health. In the 3 days following Jennifer Walsh's disappearance, Earl Whitman found himself unable to sleep. The federal analyst's persistent questions had stirred memories he'd spent decades trying to bury. On October 2nd, he drove his rusted Ford pickup to the abandoned Lynch Coal Company medical building, a crumbling brick structure that once housed the area's primary healthcare facility. Whitman had worked the mines for 37 years before black lung disease forced his retirement in 2003. What haunted him was not just the coal dust embedded permanently in his lungs, but the systematic deception he'd witnessed throughout his career. Company doctors had a phrase they used among themselves: beneficial diagnosis. It meant finding any explanation for respiratory symptoms other than pneumoconiosis, the medical term for black lung disease. They'd call it chronic bronchitis, adult-onset asthma, even seasonal allergies, Whitman later told investigators. Anything but what it really was. Because black lung meant workers' compensation claims. It meant federal oversight. It meant admitting the mines were killing us. The practice was not limited to Lynch Coal Company. Records obtained by community health worker Rosa Martinez showed a pattern spanning multiple mining operations across eastern Kentucky. Between 1985 and 2010, official black lung diagnoses in Harlan County averaged just 12 cases per year. Independent medical screenings conducted by the Black Lung Association found evidence of pneumoconiosis in over 60% of examined miners. Martinez had spent 15 years documenting health disparities in former mining communities. Her handwritten surveys conducted door-to-door in neighborhoods forgotten by official census takers painted a devastating picture of systematic medical underreporting. Families reported respiratory illness rates 3 times higher than state averages. Cancer clusters appeared in areas downstream from coal processing facilities. Birth defects occurred at rates that would trigger federal health emergencies in other regions. Jennifer saw the same patterns I would been tracking. Martinez explained during a carefully worded phone interview conducted from her home in Cumberland. But she had access to federal health databases. She could cross-reference our local data with official mortality records. What she found was systematic underreporting at every level of government. The manipulation began with company physicians, but extended far beyond individual medical practices. State health department records showed suspicious gaps in reportable disease data from coal-producing counties. Federal grants for rural health programs were calculated using official illness rates, creating financial incentives for local health departments to underreport occupational diseases. Dr. Patricia Hensley, who served as Harlan County's health director from 1998 to 2015, later admitted to the practice in confidential deposition testimony obtained through legal action. Federal funding formulas penalized communities with higher reported illness rates, she stated. Counties that showed improvement in health metrics received priority consideration for preventive care grants. We learned to interpret diagnostic criteria creatively. Jennifer's preliminary data analysis revealed the scope of this creative interpretation. Her encrypted laptop files, according to Federal Supervisor Agent David Reeves, contained evidence of what she termed systematic health data manipulation spanning multiple federal agencies. The Department of Health and Human Services, the Centers for Disease Control, and the Mine Safety and Health Administration all appeared to have databases that significantly underrepresented coal-related illness in Appalachian communities. The financial implications were staggering. Accurate health reporting would have triggered federal intervention requirements, disability benefit adjustments, and environmental cleanup mandates totaling billions of dollars. Instead, communities like Benham remain statistically invisible, their suffering documented in handwritten surveys and whispered conversations but absent from official records that determined federal policy and resource allocation. Earl Whitman understood the stakes better than most. His own medical records showed the progression from seasonal respiratory irritation in 1987 to chronic obstructive pulmonary disease in 1995 to, finally, pneumoconiosis severe in 2003, only after federal black lung benefit reforms made denial legally impossible. "They kept us sick and kept us quiet," he said, standing in the overgrown parking lot of the defunct medical building. "Made us feel grateful for company insurance that would not pay for the treatment we needed." Jennifer figured out it was not just our company. It was the whole system working together. By sunset on October 2nd, Rosa Martinez had compiled Jennifer's preliminary findings with her own 15 years of community health data. The combined evidence suggested a coordinated effort to suppress coal-related health impacts across multiple states and decades. Federal agencies had systematically undercounted deaths, underreported illnesses, and underfunded health care in coal-producing regions while maintaining the statistical fiction that mining had minimal health consequences. But Jennifer Walsh, the one person with federal database access to prove this conspiracy at the national level, had vanished into the Kentucky night. Her data remained encrypted on a government laptop, her testimony silenced, her investigation suspended indefinitely. The company doctors were long gone, their medical building abandoned to weeds and weather. But their legacy of beneficial diagnosis lived on in federal databases that still showed Harlan County as statistically healthier than communities with half its actual illness rates. The system they had helped create continued to function perfectly, protecting mining interests by making their victims invisible, one false diagnosis at a time. Agent David Reeves arrived in Benham on September 30th, driving a black Chevrolet Suburban with government plates. His official title with the Department of Commerce's Census Bureau was Regional Security Coordinator, but his background suggested broader federal law enforcement experience. Local residents noted his immediate focus on controlling the narrative rather than expanding the search for Jennifer Walsh. Reeves established his command post in the county courthouse, a limestone building constructed during the coal boom of the 1920s. His first interviews focused not on Jennifer Walsh's discoveries, but on her mental state and professional reliability. He questioned Earl Whitman for 3 hours, repeatedly asking whether Jennifer had seemed unstable or obsessed with conspiracy theories about health data. He was not interested in what she'd found, Whitman later recalled during interviews with local reporters. He kept asking if she'd been drinking, if she'd seemed paranoid, if she'd talked about running away, like he was building a case that she'd left on her own rather than trying to find her. The Kentucky State Police, led by Detective Sergeant Maria Santos, had initially treated Jennifer's disappearance as a potential abduction or accident. Santos coordinated helicopter searches of the strip mine ridges surrounding Benham, organized volunteer search teams, and issued statewide alerts to law enforcement agencies. Her investigation followed standard missing persons protocols established for federal employees. That changed dramatically after Reeves arrived. Within 48 hours, the state police received orders to transfer primary jurisdiction to federal authorities. Santos was instructed to suspend active search operations and redirect her resources to other cases. The official explanation cited matters of federal employee security requiring specialized expertise. I have worked missing persons for 12 years, Santos told a reporter from the Lexington Herald-Leader. I have never seen federal agents discourage search efforts for their own employee. Usually it is the opposite. They throw everything they have at finding missing federal personnel. This felt different from the start. Reeves' investigation followed a predictable pattern that seemed designed to discredit Jennifer's work rather than locate her. He interviewed Jennifer's supervisor at the Census Bureau's Atlanta regional office, focusing on recent performance reviews and psychological evaluations. He requested Jennifer's personnel files, credit card records, and cell phone data, but he showed remarkably little interest in the encrypted laptop that contained her health data analysis. The FBI's Louisville field office dispatched a computer forensics team to examine Jennifer's government-issued equipment. Their report, completed October 5th, stated that the encrypted files contained sensitive demographic methodology that could not be accessed without compromising ongoing federal statistical operations. The laptop was classified and transferred to Washington for what officials termed specialized analysis. Community health worker Rosa Martinez attempted to share her corroborating data with federal investigators. She brought 15 years of handwritten health surveys to the courthouse, along with medical records from 3 local clinics showing systematic underdiagnosis of coal-related illness. Reeves accepted the documents but showed minimal interest in their contents or implications. He kept asking if Jennifer had seemed upset about her personal life, Martinez remembered during a later interview. I told him she was excited about her work, that she'd said this was the most important investigation of her career. He wrote that down as evidence she was under professional stress. The federal response extended well beyond the immediate investigation. Residents reported increased surveillance of their communications and activities throughout October. The post office in Cumberland began experiencing unusual delays in mail delivery. Several community members found government vehicles parked near their homes during evening hours, with occupants who appeared to be monitoring their activities. Dr. Sarah Kim, who operated a free clinic in nearby Whitesburg, noticed federal health inspectors conducting surprise reviews of medical facilities across the county. Their focus seemed less on patient care standards than on record-keeping practices and reporting procedures. 2 clinics received citations for inadequate documentation of reportable conditions. Nyai, no. Most significantly, Reeves announced the indefinite suspension of federal health surveys in Harlan County. The Census Bureau's Atlanta office issued a statement citing security concerns following the disappearance of survey personnel and pending review of data collection protocols in sensitive communities. No timeline was provided for resuming the demographic work Jennifer had been conducting. Jennifer's case file grew thinner rather than thicker as federal involvement deepened. Her rental car was released to the agency without comprehensive forensic examination. Her FEMA trailer was sanitized and reassigned to another government employee within a week. The draft report, titled Systematic Health Data Manipulation, disappeared from all official records, classified under federal information security protocols. By October 15th, the missing persons investigation had effectively ended. Reeves returned to Atlanta, leaving behind instructions for local law enforcement to report any new information directly to federal authorities. The Kentucky State Police closed their active file, citing transfer to federal jurisdiction as the reason for discontinuing local search efforts. Earl Whitman continued, receiving occasional visits from federal agents throughout the fall of 2021. They asked the same questions about Jennifer's mental state and professional competence. They seemed particularly interested in whether she had copied her data analysis to external sources or discussed her findings with journalists or advocacy groups. They wanted to make sure she had not shared what she'd learned, Whitman observed during a December interview. Not find her, not help her, just contain whatever she'd discovered. That told me everything I needed to know about why she'd disappeared. 2 years after Jennifer Walsh vanished, federal health surveys in eastern Kentucky remained suspended. The official explanation cited ongoing security reviews and budget constraints. Community members like Rosa Martinez continued their informal health documentation, but without federal data access, proving systematic manipulation had become impossible. 2 years have passed since Jennifer Walsh disappeared from Benham Township, yet the questions surrounding her fate continue to multiply rather than resolve. Her case file, officially classified by federal authorities, contains more redacted pages than readable text. The few details that have emerged through legal challenges and Freedom of Information Act requests only deepen the mystery of what happened during those final hours of her health data investigation. Earl Whitman maintains his conviction that Jennifer discovered irrefutable evidence of federal health data falsification. According to his account, her laptop contained cross-reference databases showing systematic underreporting of coal-related deaths across multiple Appalachian states. The implications extended beyond Harlan County to what he believes was a coordinated effort involving the CDC, Department of Health and Human Services, and state health departments. She told me the numbers were wrong by orders of magnitude, Whitman insisted during a 2023 interview. Not just slightly off, not just bureaucratic mistakes, deliberately falsified to hide the real death toll from coal mining. She said it was the biggest public health cover-up in American history. Rosa Martinez supports this theory with her own evidence. In the months following Jennifer's disappearance, she attempted to access federal mortality databases using Freedom of Information Act requests. Her inquiries were systematically denied, delayed, or returned with documents so heavily redacted as to be meaningless. When she hired an attorney to pursue the matter, federal agencies claimed the requested data fell under national security exemptions. They are protecting something significant, Martinez concluded. Jennifer got too close to proving what we have known for decades, that the government has been covering up how coal mining kills people. She had the federal access to prove it, so she had to be silenced. But other theories persist about Jennifer's fate. Detective Sergeant Maria Santos, despite being removed from the case, conducted her own informal investigation into Jennifer's final movements. Santos discovered that Jennifer's rental car GPS showed stops at 3 locations not included in her official survey route: an abandoned mine shaft near Benham, a former coal company executive's residence in Cumberland, and a remote section of Pine Mountain where illegal dumping of coal waste had been reported. She was investigating something beyond the routine health surveys, Santos concluded. Those GPS coordinates suggest she was following specific leads, meeting specific people. The question is whether she was gathering additional evidence or walking into a carefully planned trap. The most disturbing evidence emerged from Jennifer's cell phone records, partially released through legal action by her family. Her phone showed unusual activity in the hours before her disappearance. Multiple calls to unlisted numbers, encrypted message exchanges, and location data that suggested she was being followed during her final day in Harlan County. One call, placed at 10:23 p.m. on September 28th, lasted 17 minutes and connected to a Washington, D.C. area code. Federal authorities claim the number belonged to her supervisor's emergency contact line, but Jennifer's family obtained phone company records showing the number was registered to a Department of Justice facility in Virginia. She called someone in law enforcement that night. Her sister Patricia Walsh told reporters. She was scared, she needed help, and she reached out to the federal government for protection. What happened after that call is the real mystery we need to solve. The environmental evidence adds another layer of complexity to Jennifer's disappearance. Soil samples collected near her abandoned rental car showed elevated levels of heavy metals consistent with coal processing byproducts. More significantly, air quality monitors in the area recorded methane spikes during the time frame of her disappearance, suggesting possible underground mine activity despite official records showing all shafts properly sealed. Local mining engineer Tom Bradley reviewed the geological data and reached a disturbing conclusion. Someone was using those old mine shafts for illegal activity. Maybe hazardous waste disposal, maybe worse. If Jennifer discovered that operation, she would have posed a direct threat to whoever was running it. And the federal government's continued secrecy only fuels speculation about Jennifer's discoveries and fate. Her encrypted laptop remains classified despite multiple congressional inquiries. The health survey program she was conducting has been permanently discontinued, with officials citing methodological concerns and security vulnerabilities that have never been publicly explained. Most tellingly, federal health data for coal-producing regions shows remarkable statistical improvement beginning in late 2021, precisely when Jennifer's investigation was terminated. Black lung disease rates, cancer clusters, and respiratory illness statistics all show sudden improvements that health experts consider impossible without massive intervention programs that never occurred. The numbers got better right after she disappeared, noted Dr. Patricia Hensley, the former Harlan County Health Director. Not because people got healthier, but because the counting methods changed. Someone made sure the data would never again reveal what Jennifer was discovering. Today, Benham Township remains largely abandoned, its population continuing to decline as health problems mount and economic opportunities disappear. Rosa Martinez still conducts informal health surveys, documenting illness patterns that do not appear in official records. Earl Whitman still suffers from advanced black lung disease, receiving disability benefits calculated on statistics that both he and federal authorities know are false. And somewhere in classified federal databases, Jennifer Walsh's final report remains sealed. A testament to discoveries too dangerous for public knowledge, questions too threatening to answer, and a truth too costly to acknowledge. The midnight census continues, but now it counts only what the government chooses to see. If this case stays with you, you're not alone. Here at Unresolved America, we cover cases like this every single day. Stories that deserve to be remembered, questions that refuse to fade. If you want to keep these investigations alive, hit that subscribe button and turn on notifications so you never miss a case. Drop a like if this story moved you, and leave a comment telling us which detail haunts you most. Until tomorrow, stay curious, stay vigilant, and never stop asking questions.